Hi, Dr. Ronald Lett. This video is to assist you in doing your case studies using the patient management form. So it's not really a lecture, it's just a tutorial on how to do your exercise. So I'd like to share my screen. Here you see the Moodle screen. We scroll down, introduction, then the expert thinking lectures. Introduction, infection and chronic disease, surgery and obstetrics, and finally we got to the patient management form. So below the patient management form, we have the expert thinking exercise, and this is what we're going to learn how to do. I've clicked on it and I'm waiting for it to open. There we are. So we have case studies. You see the patients on the left. There are 1, 2, 3, 4, 5, 6, 7, 8 cases for you to practice with. And you're going to use the patient management form over here to try and help you make decisions as an expert. You click on that. When you do that, you enter into a different form or a different website. So you can click back and forth from the Moodle website with the case studies to the patient management form. So let's choose the first patient. First patient's name is Clemence, 20-year-old mother with a dirty laceration. Back to the form. So you put in your own name. I'll put in mine. And we put in the patient's name. So she's Clemence. I remember she was 20. So she is a young adult. It's a female. Let's go back and look at what her problem was. She has a dirty laceration on her lower leg. Came from a hole. Happened 2 days ago. So let's put that information in the form. Her chief complaint is a laceration. It happened 2 days ago, so it's been 2 to 3 days. What type of problem is this? Is this medical, surgical, or obstetrical? I think it's a surgical problem, so we indicate that. We go to the case study to look at her mental status. There's no notes on her mental status, but if you look at her face, it looks like she's alert and participating in the discussion. So let's give her alert. Now we come to vital signs. Blood pressure, systolic and diastolic, pulse, respiratory rate, and temperature. Let's have a look. Her blood pressure was 110/50. Pretty normal for a 20-year-old. Her pulse is 110, respiratory rate 15, and temperature 36. So let's go back to the form. So she's got a normal systolic and a normal diastolic blood pressure. Her pulse is 110. It's a bit on the high side. Her respiratory rate was 15, a bit on the high side. Her temperature was normal. Clinical findings, it was a dirty wound. So let's see if there are any surgical danger signs. Blood pressure's okay. She had a high pulse. She's not really short of breath, just a bit of a tachypnea. Mental status is okay. Her abdomen is okay. It's really a penetrating wound, although the limb is likely to be painful. She's a 20-year-old mother, but she has no obstetrical danger signs or symptoms. So we have to think about what's going on here. So we could have a simple laceration. It could be an infected laceration. Or it could be contaminated. Perhaps with spores from tetanus toxoid or something like that. So always think of the potential possibilities. Don't just jump on your diagnosis. So what's the most likely diagnosis? The most likely diagnosis, I think, is an infected wound. So we give her medium risk for that. Less likely, it's just a laceration. But that's probably the least likely. Is it contaminated? It's got a good chance of being contaminated. So we look at the worst case possibility. We don't treat it as low, we treat it as the highest level, which here is medium. With medium risk, local treatment, clean up that wound, check her immune status. If she needs it, give her tetanus toxoid. If that wound is cleaning up and starting to look better in 24 hours, continue. If it starts to get infected and spread with the cellulitis, then you need to refer that patient. So this is how the patient management form helps you come up with your action plan. At the end of the form, you submit it. You have now completed the patient management form. So let's just go through this as the same case study. Here you have your name, or I'll put in my name. The patient's name. A young adult, female, chief complaint, laceration. The complaint was for 2 days. We decided it was a surgical problem, not a medical or obstetrical problem. The patient was alert. Her vital signs, her systolic blood pressure was normal. Her diastolic blood pressure was normal. Her pulse was high. Her respiratory rate was high. Her temperature was normal. Clinical finding, a dirty wound. Surgical danger signs, she had a high pulse. She had a penetrating wound. Obstetrical danger signs, none. Preliminary diagnosis, laceration, septic or infected, laceration, or contaminated laceration. What happened here? No, missed the spot. I'll use that one here for that. So the most likely problem is an infected septic wound, and that's a medium risk. Less likely, it's contaminated, but it's with the tetanus toxoid, that would make it medium too. The least likely is it's not infected at all, which would be low risk. So what's the worst of these? We had 2 medium risks, 1 low risk. So overall, it's a medium risk patient. The action we take is based on its worst case possibility. That means we give the patient local treatment. And if it works well, we continue. And if it doesn't work well, we refer. So this is the patient management form using the case studies as patient exercises. You see at the end of the exercise, you submit it, and that will show up on my computer, and we can look and see what your results were. We can mark them and grade them. So please go ahead and do Clements as a practice, and then do the other 7 patient management exercises.